You won't be able to see the face of 33-year-old Henry, who is living with sickle cell disorder. The fear of stigma has compelled him to hide his identity, but his voice tells of his experience with the inherited blood disorder.
I dare say I have more ups and downs. I have had all kinds of tough conditions, and even recently I'm having something called AVN, avascular necrosis, whereby blood doesn't get to the hip, and then the hip bone begins to die, and then walking, bearing of weight on that waist region is difficult.
Okay, what role is stigma playing in when it comes to sickle cell disorder?
There's a whole lot of stigma. I have a friend who her parents rejected somebody because the person is SS. I have female friends, I have male friends also, who their parents have kicked against SS. And even when they are SC too, nobody wants to come near them. They are like a leprous person.
Now, the fact about sickle cell disorder is that it is inherited from parents who are both carriers of hemoglobin AS, creating a 25% chance of having a child with sickle cell anemia. This is where genetic counseling comes in.
For those who already have the condition, it is vital so that they're able to take care of themselves. So genetic counseling is where they lay out everything for that client, for care, for his personal care. But having said that, the person may also want to have children, which is what most of us aspire to. In which case, it's important to say, look, you're likely to have children who have sickle cell, and these are the options open to you, and you choose your own path.
Sickle cell is a disorder that affects the red blood cells, which help transport oxygen from the lungs to the rest of the body. Normally, red blood cells are round and flexible, so they can travel freely through the narrow blood vessels. But when sickled, the period is characterized by excruciating pain.
Oh, God. Extreme cold weather, as they can bring about a crisis when the children are exposed to cold, extreme cold. Cold can enter them, can trigger of pain. During hot weather too, the weather is very hot, it can trigger of crisis. If it's anemia crisis, it's an emergency. If you see they are pale. But if it's pain, we teach them that they can put small towel in hot water and do hot fermentation. Apply to the area there is pain and use balm and give pain relief medicine. We say within 24 hours. It's not relieved. This child should be taken to see the doctor. But I tell them it's not always you wait for 24 hours.
Certainly, sickle cell disorder is a global health problem with psychosocial implications. The incidence of sickle cell anemia in Nigeria, according to the World Health Organization, is among the highest in the world, with about 150,000 children being born each year with the disorder. With this huge burden, here are a few suggestions on how to improve the management of the condition in Nigeria.
Education of healthcare personnel, so that wherever you go in the country, you meet a doctor, and the doctor will know about sickle cell, know when to do this or when to do that. So it's very important. Adequate supply of safe blood for transfusion. Adequate and reliable laboratory diagnostic facilities. We still see a lot of people diagnose AA when they are AS, etc. And they're thinking of introducing newborn screening so that at the time you deliver your baby, you can tell whether the baby has sickle cell anemia or not.
Media houses need to correct every negative impression. If you have sickle cell disorder today, you have a higher chance of survival than, let's say, a decade ago.
Bone marrow transplant is the only known cure for sickle cell disease. Transplants are complex and risky procedures that are not readily available in Nigeria. So, improved management of the condition, blood testing for genotypes, and informed decision-making will go a long way towards reducing the burden of sickle cell disorders in Nigeria. Yomi Otaigo reporting for Channels Television News.